The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit viconsupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. I am your host, Lisa Pitel-Killah, and I have Dr. Heather Stone with us today, and you are going to love this episode about thyroid and Hashimoto's. So let me tell you a little bit about Heather. She's one of the top functional medicine practitioners in the world. She has over 20 years of clinical experience in private practice. During that time, she's successfully helped thousands of women overcome symptoms of hypothyroidism and Hashimoto's thyroiditis. Her thyroid transformation blueprint has been used by hundreds of doctors and thus has helped countless women return to happy, healthy, and lean. Her mission is to change the face of healthcare through private practice, books, masterclasses, webinars, education programs, and retreats on her ranch in Texas, which I want to hear all about because that sounds absolutely fantastic. So, oh my goodness, welcome to the show.
Thank you. And thank you for having me. I'm excited to be here.
Yes, I can't wait to talk about it. We see, so for those of you watching on YouTube, book in the background, thyroid blueprint, right? So we're going to dive into all things thyroid and talk about that. So I always like to start off because there's always a story behind what led you down this path, right? Even just to become a doctor of chiropractic and things like that. So tell us kind of how that started and then how your intense vision about dealing with thyroid and Hashimoto's, how that came to light.
Yeah. And so like so many other practitioners, I do have my own personal story. If we go back a little bit to why I went down the path of chiropractic, I think that was kind of just fate. I always knew I wanted to be a doctor, but for some reason I knew I did not want to go down the traditional medical path. I don't know why. I didn't have a bad experience or anything like that. I think it was just intuitive. And then as I was transitioning from undergrad into chiropractic school, I was really dealing with a lot of my own health issues. And I struggled with weight. I struggled with energy. I struggled with my menstrual cycles. And I had already made the decision on what path I was going down. But, at that time, my roommate, her dad was a doctor, and she said, well, I'm going to get you in with the best OB-GYN in Austin, and you can figure out what's going on with you. I said, okay, good. So I was going to go to this OB-GYN, or I went to this OB-GYN, and I said, I think I have a thyroid problem. And that was before Dr. Google. So, this was just me looking in textbooks and being my nerdy side self. And he said, all right, well, we'll test your thyroid. And so, of course I get the blood work done. I go back in a week or so, who knows how long it was. But I go back and he says, nothing's wrong with your thyroid. I think that you have a weight problem because actually, he didn't say that. He said, I think your menstrual cycles are all out of balance, or you're not having a menstrual cycle because you exercise too much, and your thyroid is fine. And that was really the end of the story. And then as he was walking out, he turns to me and he says, oh, by the way, you're probably not going to be able to get pregnant on your own. You're going to need fertility treatments. And so that was kind of the end of it. And he walks out. And I'm like, wait a second. I'm like, okay, let me just process what just happened in 5 minutes. He said that I had menstrual cycle issues. I wasn't having a period at the time. And so I was amenorrhea. And a lot of times that happens when you have super low body fat. I knew that already. And I knew that I was struggling with weight, and I knew that my body fat was not like 10% body fat, which is typically when women start to have that issue. So I am very grateful for that experience, because the time that he told me that the reason my menstrual cycles were a mess was essentially because my body fat was too low because I exercised too much, I knew that that wasn't right.
Yeah.
I knew that that was kind of like, I don't know, a throwaway answer. And then he was off to the next patient. And oh, by the way, you have to have fertility treatments. And so I thought, you know what? That's not how my life is going to be. I need to figure this out. And so I was already on the path to going to chiropractic school. And so as I got there, I'm like, I need to do a deep dive on what's going on physiologically.
Mm-hmm.
And so from the moment I was in chiropractic school, I was studying, it wasn't called functional medicine at the time, but I was studying what we now know as functional medicine, every weekend, and going to other courses and getting, other CE credits. And so I'm like, oh my gosh, this is what I really want to do. And as I started figuring out and solving my own health issues, I just realized that there are millions of women who are struggling with these same issues that not only was I struggling with, but I knew that I had to prevent from, having this life that most people have as they get diagnosed with infertility or blood sugar problems or thyroid issues. And I just knew that I had to solve that problem for myself.
Wow. And so that's really what inspired you to build your practice, isn't it?
Yes. Yeah. And I think, when you go through it, you understand what people deal with. You understand craziness that we get from other doctors. You get how you feel emotionally when you're told something that like you're not going to be able to have kids. I'm like, my mom starts bawling when I tell her that. I'm like, wait, don't start crying, because that is not the path I'm going down.
Yeah.
Right. But I had the information, or at least intuitively, I had not necessarily the information, but I had the gumption. I had the knowingness that that wasn't going to be the path, that this was figure outable, and I was going to figure it out. And needless to say, I lost 50 pounds, and I've been able to keep that off. I have, two beautiful, healthy boys who are now 20 and almost 18. So,
Amazing.
and so I just thought, there is no reason that other women have to needlessly suffer from these hormones. And there's a lot going on underneath the surface. And if they don't uncover this, they are going to be living a life full of symptom after symptom. And it's going to be they're just not going to live like they could and should be living.
Yeah, absolutely. And so let's talk about, so for those listening who may not really know, we talk about hypothyroidism. They're like, well, what is that? What does that feel like? What is that? Do I have that? What are some of the main kind of takeaway symptoms from someone who could have a thyroid that's functioning at a lower level?
Yeah, so the classic symptoms of low thyroid are low energy. Sometimes we can't sleep at night, whether it's falling asleep or staying asleep. And it sounds kind of strange. Like if you're tired and fatigued, you should be able to sleep, but that usually isn't the case. It's almost like you feel wired and tired. So you are tired, but then you don't sleep well at night, whether that's you can't fall asleep or you can't stay asleep, like you wake up in the middle of the night and you can't go back to sleep. So you can have either or both of those issues. Many women deal with a weight issue. So no matter how little they eat or how much they exercise, the weight really just doesn't budge, or it continues to go up.
Yeah.
Women will have anxiety, depression, and it seems like you would have one or the other, but many ladies deal with both of them at the same time. So many women start to lose their hair. They will have thinning of the lateral third of their eyebrow. They will have brain fog and cognitive decline. So those are probably the biggest symptoms that most women experience. And it's not just women. I mean, men also experience hypothyroid, but the large majority of people who suffer from hypothyroid, it's mostly women.
Yeah. Yeah. Well, and those are pretty severe symptoms too, right? Like, especially when it comes to energy and weight and hair loss. And to be honest, I mean, so many people, women specifically, we're talking about, but so many people do suffer from that. And then they wonder why these things are happening, right? And the
Yeah.
hot and the cold, right? Body not
Oh
being
yeah,
it,
that
right?
one.
My hands are frozen, my feet are frozen, I can't get warm. I'm always wearing a sweater and it's like 100 degrees out. It's like, well, maybe we need to dig a little deeper.
That's right. Oh, and
Yeah.
throw a hot flash on top of that. So
Yeah, right.
there
And
you go.
well, and then the other part too, to go a little further down the path of saying identifying a problem, is that the traditional way is to test TSH. Now,
Yes.
that isn't how to identify a thyroid problem. Tell us why.
Right. So, well, first of all, the TSH, we need to know that the TSH is made from the pituitary. So
Hmm.
it's not even a hormone that comes from the thyroid. And you can certainly diagnose, low thyroid when we have a high TSH, right? Like the pituitary is pushing out all of this
Hmm.
hormone to stimulate the thyroid to produce hormones,
Yeah.
right? And if thyroid's not producing adequate levels of T4 or thyroid hormone, then your TSH goes up. But that's really a very basic way to look at this. There's so many subclinical hypothyroidism that where women are dealing with. Maybe there's many different underlying imbalances that can lead to like a subclinical hypothyroid, where
Hmm.
maybe thyroid is producing enough thyroid hormone, but you're not converting it into the active T3 hormone, right?
Yeah.
So it a lot of things are going to get missed when they just look at a TSH.
Yeah.
And it's so crazy because I see so many people who have a pituitary issue and it gets misdiagnosed as a thyroid issue. And on top of all of this, the number one cause of low thyroid is usually not even checked for. And that's because they're not really traditionally looking for the cause of why you have low thyroid. They're just trying to see, do you have low thyroid so we can put you on thyroid hormones and then
Right.
you go on your way. And unfortunately, well, fortunately, if you do need thyroid hormones, then they're going to give you thyroid hormones. But when the symptoms aren't fixed, which they're usually not fixed,
Hmm.
you then go on antidepressants and sleeping pills and anti-anxiety medication, and you're increasing and decreasing your thyroid meds. And you almost start to think that you're crazy. The practitioners look at you like you're a hypochondriac.
Yeah.
But if you will look at why does someone have low thyroid, over 90% of women who are diagnosed with low thyroid actually have an underlying autoimmune condition called Hashimoto's.
Hmm.
Hashimoto's means that your immune system is attacking and killing your thyroid. That's why you have low thyroid. So it's appropriate to make sure that your thyroid hormones are balanced. But if you don't address the underlying triggers for what's causing your immune system to attack the thyroid, you're going to continue to deal with these symptoms and they are going to get worse over time. And I think the most important thing to understand is that when you have one autoimmune condition, you are at risk for developing multiple autoimmune
Yeah.
diseases. When you have thyroid and when you have Hashimoto's, you're at risk for developing thyroid cancer. So it is not unusual for me to see patients who have not been diagnosed with Hashimoto's, but they have it.
Hmm.
They also have RA or lupus or Sjogren's
Yeah.
or, I've been seeing a lot of autoimmune diabetes lately in this patient population. And so you just start to compound all of these autoimmune diseases, and it really is completely preventable.
Yeah. And it's, when you think about it, it's really, it takes you back to think about how many things can be missed when the right markers aren't looked at, right? Even when it comes to identifying antibodies and things like that. So tell us a little bit about antibodies, because that is an important part of identification for that particular condition.
Yeah, so the two antibodies that are used to diagnose Hashimoto's are TPO antibodies, and that stands for thyroid peroxidase antibodies. Sometimes labs will call it anti-TPO antibodies.
Mm-hmm.
And then the other one is thyroglobulin. Now, also labs will call that anti-thyroglobulin antibodies. And it's really important that you check both of them. I had a patient yesterday that I accepted into care. And as I was looking at her labs, I can see what her previous practitioner ordered because fortunately, LabCorp will show your previous labs,
Oh,
the
yes.
previous marker with what you did today. And I could tell that she just ordered TPO antibodies, which were negative, but she neglected to run the thyroglobulin antibodies, which were
Oh,
very, very
goodness.
high and positive. So you can have one or the other in diagnostic, just if you have one. You don't have to have both of them positive.
Yeah. Yeah. Well, and I feel like too, it's always interesting to me because you come across some of the patients or clients where, they've had a doctor tell them that, well, if you've measured your antibodies once in your life and they're fine, then there's no problem. Right. And that is so untrue.
That
So
is true.
untrue.
I will say this, that your antibodies swing based on the triggers, right? Based
Mm-hmm.
on blood sugar, based on your stress level, based on your hormones, based
Yeah.
on, I say stress level because it's a big one,
Mm-hmm.
right? Based on underlying infections, based on mycotoxins, that's mold toxins or heavy metal toxins.
Yep.
So they do fluctuate. And also, it is really important to know that this test has about a 20% false negative, meaning like
Mm.
20% of the time, those antibodies come back negative. It's not accurate at all.
Oh,
And
wow.
so,
I didn't
in my
know that.
practice, yeah, I just assume that women who have low thyroid have Hashimoto's, right?
Mm.
It doesn't take an official diagnosis because
Yeah.
here's the thing. When you have a symptom, it is your body's way of communicating with you that something is not right.
Yeah.
Right? We have to figure out where the symptom is coming from. So whether we're looking at underlying infections and blood sugar and what does your actual thyroid panel look like? What are your thyroid hormones? Are you
Mm-hmm.
underconverting? You have high reverse T3, like all of those things we evaluate what's going on with your toxic load, your detoxification pathways, adrenal function, hormones. You have to look at all of it
Mm-hmm.
because first of all of those things will trigger the immune system to attack the thyroid.
Mm-hmm.
And if for some reason the person doesn't have Hashimoto's and they have some imbalance in there, you got to fix it anyway if you want to really help resolve the underlying symptom.
Yeah, absolutely. Yeah. And what do you think? So when people are, let's say they have a diagnosis, right? And, whether it's just hypothyroidism or if it's Hashimoto's, what are some of the most important health practices that they can really bring to the table from a holistic perspective to be able to help and overcome that?
Yeah, I think one of the most important things that we can do as a whole, especially if we're dealing with, low thyroid and any kind of autoimmune condition,
Mm-hmm.
is to really pay attention to your blood. Insulin resistance and high blood sugar, or even low blood sugar, right?
Mm-hmm.
Those
Yeah.
are at the heart of every single chronic degenerative disease. And so we have to understand that the foods that we eat, they do impact our blood sugar on a daily basis, like
Mm-hmm.
however many times a day that we're eating, it's impacting your blood sugar.
Yeah.
So it's either working to keep your blood sugar stable or it's going to cause a blood sugar spike. And so every time you have a blood sugar spike, you will also have an insulin surge. And when you have an insulin surge, it will cause the immune system to attack the body.
Mm-hmm.
And not only, it's really important that we understand that when we're dealing with Hashimoto's and these thyroid antibodies, they're closely related to antibodies of the cerebellum in your brain as well. So
Mm-hmm.
these things kind of go hand in hand, and that blood sugar and brain health are interrelated, tightly related. So when you have blood sugar dysregulation, it's really going to impact your cognition. But whether it's we eat, gluten or we eat bread, pasta, rice, potatoes, cookies, cakes, candy, soda, all of those things will raise our blood sugar, right? And
Yeah.
so then when we have an insulin surge, the body takes that excess sugar and it stores it as fat. And we will not be losing weight if the body is in a state of there's a lot of sugar and there's a lot of insulin. So therefore, we're going to have a weight problem.
Yeah.
Then it's going to really impact our thyroid and our immune system. It also is true if we go too long without eating.
Mm.
So many of us start intermittent fasting, right? Because I
Mm-hmm.
mean, I'm guilty too, because if you have struggled with your weight, you're always on this roller coaster of one fad diet after another.
Yeah.
We start to think food is the enemy. And I am guilty. When intermittent fasting came out, I'm like, yes, I knew that I probably shouldn't be doing that, but I'm like, I can fast for the best of them, right? Like I
Mm-hmm.
don't need to eat. So, I knew that that probably wasn't the best idea for me, but
Yeah.
it was easy. I didn't have to
Mm-hmm.
plan food. I could just see patients all morning and not worry about it.
Yeah.
Um, but at the end of the day, it completely wrecked my blood sugar, and I was like
Ah,
almost pre-diabetic. And I'm like, what in the world is happening?
yeah.
So then I'm like, all right, put your doctor hat back on and stop getting emotional about all of these biohacking trends. And this is not what you've taught and done for the last 20 years. Like we
Yeah.
have to step back and figure out who is this intermittent fasting for and who really should be doing it. And it's not me. And it's not anybody who has hypoglycemia, because if your blood sugar is low, then your body, your cells can't get sugar into the cell to make energy. And so what's going to happen is your pancreas, well, your liver is going to dump sugar into the bloodstream. Your pancreas is going to secrete insulin, so you get that into the cell. And then
Mm-hmm.
guess what? Your body's storing fat. And then you're making this whole insulin resistance thing even worse. And then you're causing all of this stuff going on with your immune system. So it's not about not eating. It's really about balancing your blood sugar where you're not hypoglycemic, but you're also aware of the foods that impact or raise or elevate your blood sugar. And you want to try to get the most stable blood sugar that you can.
Yeah. Yeah, absolutely. And so what do you think are a few things that a lot of doctors are getting wrong when they're helping manage women with some of these issues?
Yeah, I think the number one thing I feel like they're getting wrong is they're really focused on the thyroid,
Mm,
right? Like they just hone in on the thyroid. They look at the TSH, they increase, decrease medication,
mm-hmm.
and then they move them on their way. Now, we know that over 90%, there's some studies that are showing up to 98% of women who have low thyroid have Hashimoto's. This is
Mm,
not a primary thyroid problem. Do we need thyroid medication? Yeah. If your thyroid hormones are low, you likely do need thyroid medication.
mm-hmm.
But you have an immune problem. That is the priority here, is that your immune system is out of balance. So we can't just look myopically and say, okay, you're diagnosed, you have this label of low thyroid, and that's all we're going to really focus on. I mean, so many women, they get their thyroid balanced out and they go to their doctor and they're still like, man, I just cannot lose weight and I'm still tired and I'm not
Yeah.
sleeping. And they'll say, oh, it's just your age. Or they'll say, oh, you have low thyroid. Could you just deal with it? Like, this is your life. This is what happens when you have low thyroid.
Mm-hmm.
Oh, wait, you are postmenopausal. Well, guess what? That's just what happens when you get into postmenopause. And so many women start to lose hope and they think, oh my gosh, this is just what life is supposed to be. And
Yeah.
I want to encourage us all to know that your body is never wrong. I mean, if you have a
Mm-hmm.
symptom, trying to tell you that something is not right. So we just have to continue to search and advocate.
Yeah.
And, dealing with this population of women is really awesome, because they are really smart, because they have to advocate for themselves. They do lots of researching. Now, this can be a double-edged sword because Dr. Google is not always right.
That's right.
But, I find a lot of women are becoming more empowered because they know that they're just not going to accept that as an answer.
Mm-hmm.
And unfortunately, a lot of women know more than the traditional doctor about thyroid, and it makes it easier to weed out
Yep.
the practitioner that they're going to be with. But anyway, back to your question. The things that they're getting wrong is to only look at the thyroid and to think that this is really just a thyroid problem.
Yeah.
I think the other thing that they get wrong is when they're dealing with a weight issue or an energy issue, they just tell them that you need to go exercise more and eat less. And that is usually not going to work. And they've already
Yeah.
been doing that.
Wow. And yeah, I just shake my head. I'm like, that's so, it's like, nope. No, not it. Well, and especially, I mean, sometimes thyroid problems come along with adrenal insufficiency problems
Yeah.
too, right? And so the exercise, as much as it's healthy for us, it needs to be the right type and the right, just based on how the person feels. So that's just, yeah, such a broad, general, and potentially harming statement when we don't know actually what's going on, right? And that's where the
And I
testing is so important.
Yeah, the testing is important. And I think it's, it just, women get so frustrated, and rightly so,
Hmm.
because they're eating so little and they exercise so much that they actually end up crashing, and then they can't even walk, right? Like, so
Yeah.
over exercise to the point where it becomes distress, and they further drive their adrenal glands down, and they just get stuck in this vicious cycle and never really seeing a way out. So
Yeah.
you're right. Like, what one person needs to do for exercise is different than what another person might need to do. So giving blanket recommendations like you just need to exercise more and eat less is really, I think it's terrible information, and it needs to be you have to test, you have to see
Hmm.
what someone can tolerate, what they should be doing, how long should they go, what intensity should they do, hit, should they weight lift, is all they can do
Yep.
is right now.
Hmm.
So there's so many different options, and I think that that's what this age has gotten us to. Now we're in an we have so much information,
Yep.
and we used to not have this, right? Pre-Google, like you
Hmm.
actually look at a textbook or whatever, but now we have all this information at our fingertips, and it's hard to decipher exactly what we should be doing. And so
Yeah.
that's where you have to really get into individualized testing and individualized care, because that's what really moves the needle.
Yep, absolutely. I couldn't agree more. And so what do you think one of the most common mistakes, like other than like let's say one of them, gets that recommendation, then they go do it. I mean, that might not be what's for them, but what are the other common mistakes when they're trying to kind of deal with some of the thyroid problems and reverse them and be able to kind of lose some of the weight and things like that? What are one of the common mistakes that gets made?
Um, I think that a lot of times we start trying all of these biohacking things, and we
Mm-hmm.
don't have the foundations in place, right? Like, we can go sauna, we can go cold plunge, we can do HIIT, we can do all of these things, right?
Mm-hmm.
We can do castor oil packs, which are great, but we don't have the foundations in, right? Like, we are really understanding what it is that we need to be doing as individuals. Like, is your blood sugar regulated? Detoxification pathways, are they open and functioning properly? Do you have a lot of inflammation? And then evaluating where is that coming from?
Yeah.
Like, really getting into finding the root cause, instead of like playing out here on all these ancillary, outside in kind of approaches,
Mm-hmm.
without knowing if it's customized or what you actually need to do.
Yeah, yeah, absolutely. And so, talking about thyroid transformation blueprint, right? So, again, for those of you watching on YouTube, you can see the book on the shelf behind. So, there's 7 pillars that you outline in the book. And we don't want to give away everything, right? They got you got to buy the book because that's what this is. Well, that's what we're doing here is we're giving you, but maybe you could highlight, a quick synopsis of what a few of them might be, and which ones you kind of feel they're most important.
Absolutely. And I'll go through all of them really
Okay.
quickly, because
Hmm.
obviously we can't do a deep dive here. That
Yeah.
is what a 200 and something page book does. But
Exactly.
I think that they're all important, and you
Hmm.
have to go from 1 down to 7. All right.
Okay.
You have to do it in order, otherwise it doesn't make sense. So the first pillar is that you have to have specific measurable goals. Like, you have to
Mm.
know what it is that you want. You have to have a clear intention. You
Yep.
have to understand what it is that you're trying to shoot for. All right. Now, secondly, you have to do the testing, right? You have to have comprehensive testing. And it's not just comprehensive testing of the thyroid. A lot of people think that, and
Yeah.
we didn't really get into it, but a full thyroid panel, there's actually 12 different markers that make up a full thyroid panel.
Hmm.
And a lot of people are like, okay, well, let me go get that testing done. But see, that is one of the mistakes that we talked about, is people are only looking at the thyroid, even though you can gather a lot from that test. We have to open it up, because your body doesn't work in segments, right? Your body
Yep.
doesn't work in separate systems. It all works together. And like I said earlier, number one cause is the immune system. And what are all of those triggers? So comprehensive testing is a must. And then the third thing is that you have to have a comprehensive analysis and diagnosis. So one of the places that we get stuck and we fall through the cracks of traditional medicine is that in traditional medicine, it's a diagnosis drug therapy model. So trying to diagnose, and this is not good nor bad, it just is what it is. So they're trying to diagnose a disease, and then they apply or prescribe the appropriate medication for that disease process. But a lot of us don't have a disease that's diagnosable, right? Like we can have dysglycemia, which means you have a blood sugar problem, but it's not clinically diagnosed hypoglycemia, and it's not diabetes or prediabetes. It's somewhere in between that's not diagnosable. An adrenal problem that we're talking about is not Cushing's or Addison's, and that's what they're looking for in traditional medicine. So you have to be able to look at this from a functional perspective and understand how the body works together and what are all of the different patterns and how do you analyze this so that we can see what are the highest priority imbalances that moves the needle the most. And then the next pillar, number 4, is that you have to have customized care.
Yeah.
So you have to know where to start. You have to know what the priorities are. You have to understand what path does this one person need to go down. And then the 5th pillar is that you need a coach. You have to have somebody that really has been there and done that. And I would say this, you don't have to, but let me tell you, it took like 10,000 hours and loads of money and lots of courses and trial and error to get where I am today, 20 years to be where I am and many other practitioners. So if you're trying to go at this alone, there's a lot of mistakes that are going to be made, a lot of time that is wasted. But you get the shortcut. All of the tried and true and the things that work with a big patient population when you have a coach that's kind of been there and done that. And then the other thing, as I was creating that pillar, is that you have to be coachable. And like I said earlier, having all of this data and knowledge sometimes can be a double-edged sword. Because then, sometimes we become uncoachable, but you have to find someone who knows more than you. You have to find someone who, has the experience that you're looking for, that you can build trust and know that the process is going to work for you. So you have to be coachable and have some level of trust. And then the 6th pillar is you have to retest. I cannot tell you how many times I've seen patients go to all kinds of doctors. They do all the initial testing, but then it's been years and there's been no follow-up testing. And I'm like, you still have symptoms. So like, you have to really be on top of it. For me personally, in my practice, I usually do blood work probably every 45 to 60 days. Because when you are working on the underlying cause, the body heals pretty quickly. And if you're missing it, those imbalances are going to stay there, and you got to try something different in order to get that patient to the next step. Or the body heals and it shows maybe something else is a priority at this time, and you've got to be able to shift and change based on how the patient is progressing and how the patient is healing. And then of course, pillar number 7 is that you have to have continued customization of care as you constantly do the testing and make sure that the patient is moving in the right direction. I also find, as a practitioner, when you are retesting patients pretty consistently, it not only holds the patient accountable, it holds you as a clinician accountable. And so, I always treat how I want to be treated. And I've seen people seeing a practitioner for 5 years, and they've been dealing with the same symptoms for 5 years without any significant progression, because they just never tested and rechecked. And like, you have a job to do. And they'll hold you accountable. So that's something for me that allows me to take personal responsibility.
Yeah. And I couldn't agree more. Without that data, you don't have a trackable way to know that what's the process that's happening is working, right?
Yeah.
So
Yeah.
you're 100% correct. I couldn't agree with you more on that one. And important for the client or the patient to understand that too, right? To feel that progress and be able to see it as a almost like what's the word I'm trying to think of, like a confirmation, right?
Yes, I will say so many times, like, let's say we get 60 days into a treatment plan
Hmm.
and the patient has improved their energy, but it's not 100%.
Yep.
The patient has maybe lost 10 pounds. Let's say they're sleeping a little bit better, but they still have some symptoms. Sometimes it's also about managing a patient's expectation, because
Right.
I might think that the patient's doing amazing because
Hmm.
their plan is 8 months long. They're only 60 days in and their energy's better and they've lost 5 to 10 pounds. And so they're moving in the right direction. But that
Yeah.
patient, no matter how much you tell them that this is a long process, it's going to take us 8 to 12 months,
Hmm.
like they're expecting almost immediate feedback. So I
Yeah.
think as a clinician and to manage patients' expectation, when you do the labs, usually in 60 days, we can see pretty significant progress.
Yeah.
Like we can see big changes in blood sugar, big changes in inflammatory processes,
Hmm.
detoxification, liver, kidneys, thyroid. They make really big changes. And so it reinforces for the patient that they are on the right track. You can reestablish expectations and say, look, you're doing amazing and you're moving in the right direction. And so it keeps everybody moving forward, because the worst thing that happens is that a patient has you guys, your expectations aren't on the same page. Maybe the patient's expectations are unrealistic for where they're at.
Right.
And if you continue to test, what I was going to say is the worst thing is that a patient has unrealistic expectations or your expectations aren't the same. And then they quit and
Hmm.
they discontinue and they say, oh, that didn't work for me.
Yeah.
Look, this isn't a thing that doesn't work, right? This is a thing that works almost every single time because you're customizing care based on underlying imbalances. And so the body has no other choice but to start moving towards that state of health, because you're moving the body in that direction. And
Yeah.
so keeping the patient in care is another one of our big jobs as clinicians,
Hmm.
because the patient's not going to get better otherwise.
Exactly. Yeah. And it's interesting too. And I think that's where, when you're talking about, Google and all the information, and it can be, you can bury people sometimes in information, right? It's hard enough for health practitioners and those in the health industry that have the basis of that back knowledge is to get buried. I can't even imagine the end user and all of that data. And I think sometimes it's a matter of an attention span as well. So we have the expectations and then the attention span, and then something, in the biohacking world, new and shiny pops up and we're like, oh, maybe that's what I need, right?
Yep.
It's that hamster wheel of the shiny new things. And that can be disruptive to people with their healing journey too, right?
Absolutely. And I think the whole diet industry is, they're in it. It's a multi-billion dollar industry.
Yep.
If people actually lost weight and started feeling better, it would not be that big, that
Hmm.
they would be done. So
Yep.
have to keep people on that hamster wheel. And so they start setting these expectations like lose 30 pounds in 30 days. And so
Yep.
then patients think, well, I got to lose, that's how my body is supposed to function, is to lose 30 pounds in 30 days. And I'm like,
That's not
you
realistic.
did not fix anything. You did not fix one reason for why you have a weight problem. You
Yeah.
just starved yourself and maybe made your blood sugar problem worse. And now, as soon as you stop, it's all coming back plus some.
Yeah.
So it's about re-educating as a clinician, re-educating, resetting expectations. And like you said, even we can fall prey to, I'm like,
Yep.
intermittent fasting. Oh,
Yep.
that's got to be the thing. It's
Right.
easy.
Yeah.
Surely I'll lose some weight on it. No. So you sometimes even, I mean, you can imagine what a patient might be feeling when they see all of those new fad things. I once was approached to write a book, a diet book,
Hmm.
and they wanted me to write a diet book and give some recipes. And I said, oh, okay, I already have one written. Like it's what I give my patients.
Yep.
And this is going to be easy. Just give it to, somebody to make it a book. Like it's in a book. I'm sure they needed to fix it to make it for retail. And they looked at it and they said, we need something like more fad. Like this is, I'm like, but this is what works. And they're like, no, we need something like the South Beach diet or like something like that. And I'm like, yeah, I think that this is going to be a good fit because that I am not going to go against my, my morals and my values. I'm like, this is what works. And I'm not into the fad, like lose, 100 pounds in 2 days.
Yep.
We have to set realistic expectations and give women something that's realistic and something that actually works and is in a healing path. But it just shows you what that diet industry is looking for, something like a carnivore diet or something that's, kind of faddish, has a name, but it's never going to work long term.
Yeah. Yeah. No, very true. And so, okay. So first off, tell everybody. So I want to hear about the ranch but in a minute, book, where's the book available on your website?
The book is available on Amazon. So
Perfect.
It's super easy. Then go to Amazon, just type in Thyroid Transformation Blueprint, or you can type in my name and it will pop up.
Perfect. Okay. If they want to find you, they can go to your website.
They can go to my website, but a better place to find me is go to Facebook. I have an amazing Facebook group called Happy, Healthy, and Lean.
Amazing.
And at the time of this recording, there's about 35,000 amazing women in that group.
That is awesome.
Yeah. And it's, oh my gosh, I could not have and I'm not taking credit for this. These ladies are in this group and they are all positive. We make sure that, there's no complainers and whiners and that kind of thing. It's a group of women who uplift each other and they're all about really learning. And that's where I give a lot of my content. I do classes and I do Thyroid Thursdays. And so that's the best place to connect.
Perfect. Okay, so we'll have that link in the bio here, as well as the name of the book, and then also just the website, just in case someone's looking to become a patient and obviously get qualified for that. And so, tell us about the retreats.
Okay, so it's important to me that we obviously take care of our health. And one of the best ways to take care of our health is to make sure that we're eating clean food. And so I started a regenerative farm or ranch. And so on that ranch, what I wanted to do was to create like a farm to table retreat experience. And so I started doing this with my current patients. So after they've been in treatment for 6 months or longer, we do an advanced thyroid transformation retreat where we dig in, we do cooking classes, we do yoga, we do some advanced testing so that we can see, how do we dig a little bit deeper to even further their health experience. I bring women together and it's an amazing community. We get to talk about, what it is that our goals are and what does our future look like, because this is so important. Because if you can't see yourself, in your future, then you're really allowing the world just to start creating your future for you. But you actually can start to shape and create your future, but you have to have intention and you have to see that clearly. So that's kind of what we do at these retreats. And this year has been a huge year of growth and expansion, but in 2025, I think I am going to open this up to women who are not patients yet. So to get started on their health journey, we'll start it with a retreat and then follow up with longer term treatment plans.
Oh, that sounds so amazing. Amazing. So, and where can they find more information about like, obviously we have to wait to 2025, but so maybe there'll be more to come on that, where they can find information if they want to start there.
Yeah, you can also find me on Instagram. It's called Born to Heal Ranch and Retreat. And I have really fun videos of all of my animals and my huge garden. And I'm on Facebook too. So it's Born to Heal Ranch and Retreat.
Love it. Love it. So we'll have those links in the description bio here as well, just so that if you guys want to dig in and start to follow and get ready for 2025, I think that you will be well on your way to know that that's what you want to do. So, oh my gosh, so much amazing information. Thank you so much for that. And so, yeah, don't forget everybody, give this episode a like. If you're watching on YouTube, subscribe to my channel. And if you're listening on your favorite podcast host, make sure you give this episode a like. And thanks again, Heather, for joining us today and providing us with your time and all of the amazing information and offerings that you have.
Awesome. Thank you so much for having me. I really enjoyed being on.
Excellent. All right. Well, thanks again, everybody, for tuning in, and we will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit LisaPitel-Killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Lisa Pitel-Killah.